Assalamualaikum, greetings to my respective lecturer and fellow friends. I'm going to present about post-traumatic disorder or PTSD and its symptoms and how to treat the condition. Post-traumatic stress disorder, or also known as PTSD, is a mental health condition that's triggered by a terrifying event, either experiencing it or witnessing it. Symptoms may include flashbacks, nightmares, and severe anxiety, as well as uncontrollable thoughts about the event. People with PTSD have intense disturbing thoughts and feelings related to their experience that last long after the traumatic event has ended. They may relive the event through flashbacks or nightmares. They may feel sadness, fear, or anger, and they may feel detached or estranged from other people. People with PTSD may avoid situations or people that remind them of the traumatic event, and they may have strong negative reactions to something as ordinary as loud noise or an accidental touch. A diagnosis of PTSD requires exposure to an upsetting traumatic event. Exposure includes directly experiencing an event, witnessing a traumatic event happening to others, or learning that a traumatic event happened to a close family member or friend. It can also occur as a result of repeated exposure to horrible details of trauma, such as police officers exposed to details of child abuse cases. PTSD needed to get awareness as widely and also the symptoms of PTSD. Post-traumatic stress disorder symptoms may start within 1 month of traumatic event, but sometimes symptoms may not appear until years after the event. These symptoms can cause significant problems in social or work situations and in relationships. They can also interfere with your ability to go about your normal daily tasks. Symptoms of PTSD fall into the following 4 categories. Specific symptoms can vary in severity. According to American Psychiatric Association, the symptoms of PTSD are intrusive thoughts such as repeated involuntary memories, distressing dreams, or flashback of the traumatic event. Flashback may be so vivid that people that they are reliving the traumatic experience or see it before their eyes. Avoiding reminders of the traumatic event may include avoiding people, places, activities, objects, and situations that may trigger distressing memories. People may try to avoid remembering or thinking about the traumatic event. They may resist talking about what happened or how they feel about it. The first symptom is alteration in cognition and mood, inability to remember important aspects of the traumatic event, negative thoughts and feelings leading to ongoing and distorted beliefs about oneself or others. For example, I am bad, no one can be trusted. Distorted thoughts about the cause or consequences of the event leading to wrongly blaming self or other, ongoing fear, horror, anger, guilt, or shame, much less interest in activities previously enjoyed, feeling detached or estranged from others, or be unable to experience positive emotion, void of happiness or satisfaction. Next, alteration in arousal reactivity. Arousal and reactive symptoms may include being irritable and having angry outbursts, behaving recklessly or in a self-destructive way, being overly watchful of one's surroundings in a suspecting way, be easily startled or having problems concentrating or sleeping. Many people who are exposed to a traumatic event experience symptoms similar to those described above in the days following the event, for a reason to be diagnosed with PTSD. However, symptoms must last for more than a month and must cause significant distress or problems in the individual's daily functioning. Many individuals develop symptoms within 3 months of the trauma, but symptoms may appear later and often persist for months and sometimes years. PTSD often occurs with other related conditions such as depression, substance use, and other physical and mental health. PTSD can be successfully treated even when it develops many years after a traumatic event. Treatment depends on the severity of symptoms and how soon they occur after the traumatic event. Here are the treatments for PTSD. First is cognitive behavioral therapy. One category of psychotherapy, cognitive behavior therapies, CBT, is very effective. Cognitive processing therapy, prolonged exposure therapy, and stress inoculation therapy are among the types of CBT used to treat PTSD. Medication. Medication can help to control the symptoms of PTSD. In addition, the symptom relief that medication provides allow many people to participate more effectively in psychotherapy. Some antidepressants such as SSRIs and SNRIs, selective serotonin reuptake inhibitors, and serotonin norepinephrine reuptake inhibitors are commonly used to treat the core symptoms of PTSD. They are used either alone or in combination with psychotherapy or other treatments. Other treatments, including complementary and alternative therapies, are also increasingly being used to help people with PTSD. These approaches provide treatment outside the conventional mental health clinic and may require less talking and disclosure than psychotherapy. Examples include acupuncture, yoga, and animal-assisted therapy. To conclude this topic, PTSD is a really serious disorder. I believe that actions need to be taken immediately when there is warning sign. Early symptoms that can be found in the youngster need to be prevented from developing into worse. The signs and symptoms they may be present in someone who has this disorder may be reliving horrible event through flashbacks, dreams, or even nightmares. PTSD does not have a specific age limit, but most men do seem to experience this disorder more than most women do. PTSD is a complex, highly disabling and suffering disorder where the past is always present in people haunted by the drag frozen in memory of the traumatic events. However, PTSD also represents an opportunity for psychological and spiritual growth due to human ability to adapt and thrive despite experiencing adversity and tough time. And that's all for my speech. Thank you.